You feel like when you're walking, tell me again what you said?
I feel like when I'm walking that I have a tendency to want to turn this foot out.
Right.
Because I'm looking at my leg and I'm seeing that my leg is not straight.
Right.
So I have to consciously think about keeping my toes pointed forward.
Okay. And so when I give you that pressure, what I'm doing is I'm pushing the inner knee out and I'm pulling the ankle in.
Right.
There's good movement in there, a fair amount of movement. Can you pull that pant leg up so we can see the knee itself?
Sure.
Okay, so you just relax. I'm going to do it again.
Okay. Oh, that hurt a little bit.
So is it hurting inside this area or out there?
Inside here.
Okay, I'm going to try and change my pressure.
Okay.
And so part of why I think you're feeling like the foot's turning out, the knee is coming in, it's probably coming from either the hip or the ankle.
Okay.
So when they put the knee in totally straight, right?
Okay.
This angle, so if I went from the center of your hip socket to the center of the knee, and then from the center of the knee to the center of the ankle, that's called a Q angle, like the letter Q.
Okay.
If you look, and we just put both of them up there, this one, you don't have to do that. This one has more of a Q angle than this one does,
Okay.
right? And so as the hip rotates in, the knee comes in, the foot naturally turns out. It's also probably a function of the stiffness you have in the extension. So in order for me to allow that knee to swing, the foot to swing through space, if I make my leg shorter, it's easier for that foot to swing forward. The way I make my leg shorter is I turn my toe out.
Okay.
That's why when somebody's stepping over something, they turn their foot out and step over. It's not the best way to do it, but it's just a response in the body to functionally shorten the leg. Something that's a little bit loose, not to say that that's a harmful thing or anything, is there is joint laxity out here. So when I kind of move you this way, I can feel that side of the joint open up and then come back together. Can you feel it clicking?
I do. Yes, I do.
So that clicking are the two surfaces coming together and touching. But again, I think the focus for you is going to be on the hip.
Okay.
Relative to the knee and the ankle.
Okay.
So like we did the video the other day, you're on the bike, you have a tendency to let that knee roll in. That's coming from the hip.
Okay.
We want to focus on the knee rolling out.
Okay.
Letting the hip open up. And so today, the whole treatment is going to be focused on that.
Okay.
We're just going to work on that hip motion. I'll show you a couple of stretches to put the hip in that position. And then when you're talking to the surgeon, depending on, and I don't know your surgeon personally well enough, but if they do a physical exam, like I'm sure the camera can't see it, but I absolutely can see that lateral knee has a little more mobility.
Okay.
Which, like I said, I mean, it is what it is. It's not good or bad. It's not dangerous. It's not harmful. There's no negative part to it. You just want to be aware, okay, so I need to put a little more effort on mobilizing the hips and paying attention what you're doing to walking a little straighter, rebuilding that coordination pattern.
Okay.
Is that tender at all?
Yes, it is.
And I still, go ahead.
Is it still normal for it to be swollen?
Yes.
Like this? Okay.
Yeah.
Because I've been worried about that. We're at 8 weeks right now, today.
Yeah, I think anything under 12 weeks down in this area is normal.
Okay.
I think the fact that you're not walking maybe as much because these muscles get sore, that keeps some of that fluid down there. Are you doing the rolling pin massage?
Yes.
Okay.
In between making cookies.